Talk on good? Okay. So what I do is I've just prepped her now, and we're going to try and put it into vermilion, which is the red part of her lips. I always explain that it's never perfect, and there's always swelling for about 48 hours afterwards, and then it gradually comes down. But the best thing to do is once it's injected, if it looks good on the table, is to sort of forget about it for 2 weeks, and then any little irregularities. So it's got a little lidocaine. I have them ice it. I try and be as gentle, but it always smarts a little bit. 1, 2, 3, sorry. And she's a pro at this. She's really good. So I inject a little bit at a time, and I'm very careful and measured with it. I also keep an eye on the syringe so that I get even amounts everywhere. And she's really good with this. Afterwards, I let people do whatever they want. They can exercise, go to the gym, kiss whoever they want. It's quite forgiving. There's a little bit of lidocaine in it, so it's normal to feel a little bit of numbness. I always tell people it's better to undercorrect than to put too much. You can always add, it's hard to take away. She's really good with this. Once it's in, it's usually not so uncomfortable. It's the initial little poke in the lip that's uncomfortable. 1, 2, 3. Good job. Good stuff. She's excellent, super brave. Much braver than I would be. One of the questions I get asked, if somebody has super thin lips, can they make them look like the movie stars? And I don't think it's possible to do it all in one shot. And certainly, you know, or even at all, there's a limit to how much you can pump something up. But if so, you certainly want to do it in little steps at a time. Massage a little bit, try and smooth it out. What I explained to everybody too, it's almost like a jelly that I'm putting in. It's hyaluronic acid. This is Juvaderm Ultra, not the Ultra Plus. And it's interesting, when you inject it at first though, it feels quite firm and hard, and it'll gradually soften. Actually looks and feels pretty even. It's a little bit at the midline. This spot's a little more sensitive. 1, 2, 3. Good. She's fantastic. Barely even flinches. Again, she's having no bleeding, so this will have a little bleeding, but she's had absolutely none. And you can see her lips are a little fuller. I'm going to come around the other side. Maybe the other side. I put a little bit more on her this time. She's had these done once before and wanted a little bit more augmentation to it. 1, 2, 3. Also, with a new patient, I'm always a little more conservative. Somebody I've already done these once on, have a little sense of what they like and what they don't like. So we're going to put a little bit more in her upper lips today. The only important thing is that they can't take any aspirin, bufferin, or Excedrin particularly, but even things like Motrin and Advil make you a little more prone to bruising. So I always tell people Tylenol's fine, but everything else you should avoid. 1, 2, 3. Good job. She's fantastic with this. You all right?
Mm-hmm.
Good stuff. So what I like to do after I do this is I try to massage it along. As I said, they all get swelling afterwards. The hyaluronic acid absorbs water, so they tend to get a little plumper on day 2 and 3. And the swelling is never exactly the same, so as much as humanly possible, if I like the look of them on the table, then I tell them to really forget about it for about 2 weeks. Because there'll be little changes and they can drive themselves nuts if they worry about it. You certainly can apply ice afterwards if you have time. Most people are going to the office or working, so they don't have time. Ice will help with swelling, but there's still an absorption of water that takes place regardless. So what I'm going to do now, which is pretty even, excuse me, I always like to have the women lick because they're their own worst critic, and then they can see if they want a little bit more on their upper lip, and if there's any left, we'll put some in her lower lip. So I'm going to hand her the mirror, and then she'll take a peek. Yeah, thanks. Go ahead. So see if you want more or less. I think you're pretty even.
I think so.
Yeah, so I think that looks really good.
Mm-hmm.
And then you got a little bit, so you want to put a little bit in your lower lip?
What do you think?
Yeah, probably would. You seem to like fuller lips.
Okay.
And it's not too much stuff. Go ahead and pop that down. So I'm just going to put it in the central area for her. 1, 2, 3. Sorry. And again, with all these things, there's no right and wrong. Some women like fuller lips, some like less full lips. I always tell people to be a little conservative. I won't do somebody that wants a huge amount, but again, I'm also very willing to accommodate somebody else's style more than mine. So if somebody wants them a little fuller than I would do, that's good, or a little less full than I would do. I won't make somebody humongous if I think it looks really strange. 2, 3. Sorry. And as I said, if somebody wants a significant amount of filler put in, I think it's always best to stage it a couple weeks apart. There's only so much you can inject into the vermilion, the red part, before it starts to spill over significantly. Last little poke, 1, 2, 3. Good job. Some pressure there. Go ahead and take that away for a second.